Association of Community. Welcome to the National Association of Community Health Workers quarterly policy update call. I want to thank our policy committee for hosting this every quarter. My name is Denise Octavia-Smith, and I'm the inaugural executive director of NACHW. Let me pass this to Darrell Fox and Ashley Wennerstrom, and thank you so much for joining us today.
All right, thanks so much, Denise. I think I'm up first. Hi, everyone. My name is Ashley Wennerstrom. As Denise said, I am the co-chair of the National Policy Committee, along with my colleague Darrell Fox. And we do as much as we can to support policy development and work through NACHW with the support of NACHW staff who must be recognized, Angie Kuzma and Peter Salali as well. So it's a pleasure to be here today. So I'm going to ask Peter to just go ahead and advance the slides and we will get started. I think we can move on to the next one when we're ready. All right. So as we get started, just want to give a shout out to our NACHW members. We know that there are many of you here today, and we are very happy to see you all. Your presence and participation in our organization really helps us build a member-driven organization that is focused on uniting CHWs. We know that folks have lots of different identities in terms of gender, race, ethnicity, and we hope to do our very best to represent them all so that we can achieve health and well-being in all of our communities. And there are a host of benefits to being a member that are listed here on this slide, and we encourage those who are not yet members to become one today. So we can go ahead and move on. All right, and before we get into the meat of our agenda, I do want to ask everyone to save the date. We have our Unity Conference coming up in August. It'll be the 3rd through the 5th in Austin, Texas. We're very excited to be doing a meeting this year that will be both in person and have some virtual options as well. This is the first time we'll be together since we officially launched the organization back in 2019. So we hope that you all can join us. And for now, please save the date. On our next slide. So we introduced ourselves already. We will we'll skip this. So today we are delighted to have several guest speakers with us today. We have our staff listed here on the slides, and then we have several friends from Partners in Health. Darrell's going to provide a more in-depth introduction of those folks, but we're very glad to have Justin Mendoza, Lucas Allen, and Katie Bolbach with us today, as well as Catherine Martinez.
So thank you all so much. And we really wanted to start out with just asking you all a couple of basic questions, and you'll see them dropped in the chat soon, but you will see them also on the screen. We really want to ask for your words, as brief as you can be, what CHW-focused policy developments in your state are the most helpful, the most hopeful? What are you the most hopeful about? In other words, what are things that are happening right now that you're like, yes, I'm excited, this is really good for the CHW workforce, and this is what's happening today in our state, or this is what's happening very soon in our state. Thank you for, yes, the instructions for putting your state name in there. And you also can take the opportunity to say who you are as well. My name is X. I'm a community health worker here. We're going to give people some time for that. And I'm going to take a look and see. All right, very excited about California and PA, hopeful about the legislation around CHW financing. And California, CHW benefits through Medicaid and CHW certification is in the works. All right. All right. A lot about legislation, reimbursement, Pennsylvania, shout out, Texas, shout out. I see Virginia in the chat. I know there's some things happening there. California many times. There's a Medicaid study being funded for sustainable funding models. And I see that, Kimberly. I'm not sure if I can see the state. Michigan, okay, a SPA, state plan amendment. Okay. And as you can see from across the country, some of these entries, there is a lot happening. This has been an amazing, as Denise and others would say, moment in the movement for community health workers and promotores. These are exciting times. There is actually policy and advocacy happening pretty much in every state and territory associated with the United States, and also other places around the world, which I know we'll talk about another time. All right. I think I'm going, okay, Pat in Ohio, she's hopeful about the career path and compensation conversations going on there. Okay. Okay, I see a shout out to Louisiana here. Some new CHW funding through Medicaid. It's not perfect, but it's a start. There you go. There you go. Carl Rush giving a shout out to Texas here. All right, and yep, Unity, yes, yes. Yes, getting prepared, particularly with Texas, particularly Austin being the host for Unity. I see more about Louisiana. I see Connecticut, shout out, Rosa. Shout out, yes, yes, yes. Okay. Yes, Tracy Carter, we've been having some conversations here in Georgia. We have Advocacy Day coming up. It's just some great stuff happening here in Georgia. All right. Well, I'm going to let people please continue to type in the chat. Please continue to read. We have so many great speakers today. I'm going to pass the microphone on. And our first speaker, who's going to be joining us and talking a bit with us and give us an update, is Justin Mendoza. He's the advocacy lead for Partners in Health United States. And he's going to tell a little bit more about himself, and he's going to get us started. So, Justin, that's your intro. You are next up to go.
Awesome, thank you, Darrell. And I'll have my colleague Lucas will also join me in just a moment on these on this part of the presentation. But super excited to talk with folks here. I'm just going to give us a little kind of recap of what happened at the end of last year, after a lot of work that many folks in this call, we really tried to improve a proposed bill and tried to get some stuff through that we have mixed results on. But we wanted to give you a recap on what that looked like. And then I know Lucas will do a deep dive on what the legislation actually does. And then I think we turn it back to Denise, which is exciting to kind of talk through what NACHW did to try to influence the policy. So yeah, if we can go to the next slide, I'll start here. So the first thing is, we have a House bill number up here, HR 2617. If you were following the news, the political news at the end of the year, this is the omnibus spending package. It's all of the legislation that funds the US government. And right at the end of December, Congress actually passed their bill to fund the US government through this upcoming September, which is normal. This is the normal pathway these days. The fiscal year runs from October 1 to September 30th, but the US government is almost always delayed in passing their final appropriations bill. So I did a bunch of things. Here are some of the highlights, the good ones, probably more broadly. Increasing the funding for public health programs, the CDC, mental health programs, even substance abuse programs, different pieces there. The Prevent Pandemics Act, which we'll take a deeper dive into over the next couple of slides, which is a mixed bag, but includes some language about community health workers, which is from the Building a Sustainable Workforce for Healthy Communities Act. And then overall, the package here avoided a government shutdown, increased federal investments across a ton of different healthcare programs, and also just, made it possible for projects to continue that otherwise would have sunset. The downsides, well, they're kind of big. As we all know from working communities, COVID is not over, but the US government has basically decided it is. There's no supplemental COVID funding passed last year. And now even the White House has gone in that direction. Another big low light from our perspective was that there was no dedicated funding to sustain community health worker programs that were started in response to COVID, or funded, not even started, but funded to respond to COVID-19, or to fund even the quote unquote CHW bill from the section before it. The language made it through, but no money actually made it through. And then finally, the big one for folks who are enrolled in Medicaid or who qualify for Medicaid is the end of continuous eligibility. So folks who would have been removed by their states from Medicaid coverage will be removed from their state's Medicaid coverage this year, which is a big one. It affects so many folks who who are connected in our communities. We'll go up to the next one here. So let's talk a little bit about this bill. Lucas will give you the more deep dive details about what every line does, but I wanted to talk a little bit about how we got here, how we ended up with a bill on community health workers that I think is safe to say is a very mixed bag in terms of its impacts. So when we start from the beginning here, the CHW bill was drafted a long time ago, initially back in 2021. And some community health worker partner organizations, as well as Partners in Health US, we came together and talked to the lead legislative office, Senator Casey, on how do we get a bill with community health workers included with a definition that is closer aligned to the APHA's definition, with funding that can be more sustainable, with programs that would be a little bit better. The initial bill included a huge section that would have enabled state plan amendments to sail through with Medicaid and created a little bit clearer path. It also included $8 billion with a B investment in community health workers in the short term to help programs, build to the next level, hire in folks and build the infrastructure. Unfortunately, none of those really juicy, exciting parts of the bill made it in to the final package. And in addition, we and NACHW and a number of other organizations tried to influence the kind of compromise bill that was created. And for political reasons, a lot of, actually everything we suggested was not incorporated at that point. So you see a timeline here at the bottom, right? That in 2021, they introduced this bill. We actually kind of like it at that point. Well, I mean, I don't mean to speak for NACHW, but PIHUS kind of liked the bill at that point. We were excited about it. We were sharing it with folks. In 2022, really January, February, they reintroduced the bill. Every new Congress, they have to reintroduce. So they reintroduced the bill, and or not every new session. So they reintroduced the bill in the Senate. It advances through the HELP committee with bipartisan support as a part of the Prevent Pandemics Act, which is a huge bill that includes reforms to the FDA and the CDC and a bunch of other things. But it goes into that, and the compromise bill takes out everything about Medicaid, takes out the $8 billion in funding, and importantly, just erases the CDC's current definition of CHWs without giving a new one. And then it has other tweaks to it, but those are probably the three big highlights. We joined together with many other folks and tried to send in letters to get the offices to really uphold some of the original bill, to go even further and think more about some of the values that are out there. And unfortunately, it didn't move. The final version of the language is what made it through. It was introduced in the House, identical to what was introduced in the Senate, and then finally included in the omnibus bill in December. And if we move to the next slide, I think Denise is going to cover this in more detail in a couple minutes, but I just wanted to give a shout out to NACHW's incredibly well-written letter that tried to influence this bill at the moment that we had, which, sorry, just the next slide, it's got a little screenshot of it, just to show, these efforts would have been amazing. This was going to a bipartisan effort. It actually articulated how to make this into a very strong bill that would really support CHWs. We didn't get there. So now, the big question is, how do we make the best of what is there and try to influence it moving forward? But I'll pass it to Lucas, who is the advocacy manager from Partners in Health US, to take it from here.
Thanks, Justin, and thanks everyone. It's so great to be here with you, and we can go to the next slide. I really resonated, Darrell, said a quote from the chat that someone said, "It's not perfect, but it's a start." And I really resonated with that for this bill because we tried to make it stronger, but it's really hard to pass legislation through Congress. And so, you know, it was still, at least to me, exciting to see a piece of CHW legislation being included in the year-end spending bill and signed into law at the end of December. And if anyone's curious, please feel free. You don't have to look into this, but if anyone wants to look at the actual bill, I'll put a link in the chat of the whole spending.
Hi, good afternoon. This message is for Shanna Allen. Miss Allen, this is Tracy Carter
And
calling from
Tracy,
Peach State Health
you're
Plan.
not currently
If you
muted, so if you could, thank you. So on that link in the chat, if anyone wants to see the bill, you can do Control F and look for 2222. That's the section of the bill, or you could go to page 1286. It's a very long bill. So this bill made it in here. So let's talk about what the bill does. And then I'll talk about what the bill does not do, which, as Justin mentioned, is a lot. So since 2010, Congress has authorized the U.S. Centers for Disease Control and Prevention to create a dedicated federal grant program for community health workers. But Congress has never provided funding for this. So this is a very confusing thing, right? Because there's two steps for a lot of the federal grants in, or for how Congress gets money out the federal government's doors. First, Congress has to authorize the program, which I think of like placing a cup on a table, right? But then Congress also needs to appropriate money to the programs, which I think about as filling the cup with water. So we've got a cup now, we've got a place for these funds to go. Congress has authorized the program, but Congress still needs to fill it with water and actually provide the funds that they've said the CDC needs to do this grant program. So what the bill does, and you can see on the right side of this slide, the language from the bill text, it authorizes $50 million for each year over the next 4 years for this program, and Congress still needs to provide the funding. In addition to that, the bill makes some technical changes to how CDC would operate this program once the funding is appropriated. As Justin said, it removed the definition of community health workers with no replacement, something that's concerning. It defined eligible entities for this federal grant, and it changed some of the language around who should be prioritized in this grant, including medical underserved populations, communities of color, rural communities. And we can go to the next slide, which will be my last. And that's just going to go over some of the things the bill does not do. So as I mentioned, it doesn't provide the funding for the CDC grant program. That's something that we need to harness our power and still get. So that's one of our big goals this year. And then it doesn't create access to sort of more sustainable funding sources like Medicaid and Medicare, as Justin mentioned. Those were taken out in some of the negotiations to get bipartisan support that was needed for this bill to become a law. So once the funding is provided, this would still be time-limited federal grants, and there'd still be a need for additional funding. So that's it for me. We can pass it to Denise, but I know I think we'd also be happy if anyone has any questions about what Justin or I covered. Please feel free to ask in the chat as well. Or Denise, feel free to take it away.
Oh, thank you so much, Lucas and Justin. You know, I threw into the chat, is this type of update helpful? We're just so grateful to have the partnership, and folks are really resonating with just being in the space. I think telling the story is really important, and breaking this down is also really important. I'm still inviting people who are in the waiting room, so excuse me. Next slide, please. You know, where I really wanted to land and sort of wrap up this section is just, if you haven't had a chance to read section 2222, I just wanted to pull out some of the language. So this is cut and paste, so you can see some of the reason why, you know, Justin has mentioned it is something, but it's not what we wanted, right? It's wonderful to have acknowledgement and recognition, but it's also important for this type of language, which has impact all over the country, for the workforce to really be informed by our identity, right? And some of the existing policies that have existed for decades that help to anchor, right, this work in equity. So just briefly, let me hit a couple of topics, and y'all will get these slides and have a chance to, really take this in at a later time. The way that the grants and contracts and cooperative agreements are referenced here in section 2222 talk about existing funding arrangements. Justin and I, with many others on this call, we've written blogs about this, we've spoken on webinars about this, that these existing funding arrangements are in and of themselves sort of historic and not reflective of the way in which we need to get dollars into the community, to community-based organizations, to CHW networks and associations. So looking at those funding models is critical. We don't want sort of business as usual here. The document talks about things being subject to existing certification arrangements or other licensure. Just waiting for the slides to get back to where we were. But anyway, and we know that in a couple dozen states, no certification or licensure exists, which begs the question, what is going to be the model or the approach? Barring any legislation that may not even recognize CHWs as a profession in that particular state. Also, we know that not all certification has an equitable lens. Some of that creates barriers to CHWs who may not have a high school diploma or other barriers that are well described at the state level. So, these are some of the reasons why we gave pause to the existing language. I see folks throwing in to the chat other considerations. I want to just jump to the end, and then my time is probably up. This piece in section 2222 ends with the statement that in 4 years, the secretary will identify and disseminate evidence-based practices regarding the recruitment and retention of CHWs and the word I think none of us are happy to see, paraprofessionals. But what's really important is that there is an end here which could result in even more definitive language and funding models regarding our profession. So it's important that what happens in these 4 years is reflective of the way in which you all at the local level and at the state level are guiding, are leading, are designing, are evaluating these activities and programs. So I want to thank everyone who contributed to the letter that NACHW developed. Shout out to Partners in Health, Elizabeth Lee, if she's on the call, who helped us to write the letter and get it to Senator Casey's office and to the Senate Help Committee. You're right, I don't think they read it, but what we're doing is building momentum in our field and in our community. And so what's important is we're activated now, and we're going to continue to be activated toward this work and toward these discussions. So thanks for the time. Next slide. Okay, I think I'm passing it to Angie.
Yes.
Or
Yeah.
maybe Darrell.
Darrell's going to take the microphone, and I want to thank you all so much. First of all, you've heard a lot today. You've heard from Justin and Lucas. You just heard Denise talk about section 2222. And we just want to pose a question to you right now. Just think about some of the points you heard from Denise. If the 222 section 42s is implemented, what is the potential impact on CHWs in your state? Just off the top of the dome, just think, based upon what you just heard briefly, what do you think would be the impact if this is implemented on CHWs in your state? And we'll take a few minutes and we'll look and share some of the comments in the chat. And then Katie will get us started on the next conversation about CDC public health infrastructure. And I shared her bio also in the chat. Haven't seen any yet. It's a big, big question. If provisions of section 2222, yes, Thank you, Carl. If it's passed, any state Medicaid funding model will require definition of CHW qualifications in order to be approved by CMS, but they don't need to, okay. That's back to the whole question about credentialing certification. CHW would need to be involved in defining those qualifications and negotiating with the state Medicaid office. You'll hear this theme about partnership. Those of you who saw NACHW's policy platform is know that partnering with CHWs is one of the third legs of the stool, and we really hope that nothing about us without us is not just a mantra that people just talk about, but hopefully they'll be about it in consulting. The 46 plus CHW networks, associations, alliances, coalitions, and the many CHW leaders that are in pretty much every state in this country. We're giving people a little bit of time as I fill up a little bit of time. We actually are making good time today for all the folks. Would have to meet certain, yes. So if that, yes. So if passed, our professional association in her state would have to meet certain evidence-based requirements in order, yes. Someone is expressing, Margarita, expressing some concern about the true intent of the model, the impact if we misuse the model, the CHW model, and focus only on the title. Will it result in any conflict with the state legislation? That's a good question. Yeah. So if you look at the chat, you'll see people are in real time trying to think through this question and also the whole connection with CHW credentialing and certification that goes along with this. Adam asked a great question. What is the trade-off between, wow, sorry, I just lost it moving in the chat. What is the trade-off between federal recognition of CHWs versus NACHW working state by state to achieve greater harmonization? Yeah. I know there's some people who might have some thoughts on that, and I might see it in the chat. But you bring up a good point, Adam, and as legislation moves federally, while some states are still having conversations, we're going to have this dichotomy. And the key piece is forums like this that bring us all together so that we can be aware of what's going on the ground in the states to help inform what's going on federally, and also so that we can all get involved and engaged. This knowledge of us sharing, what we've heard from Denise, Justin, and Lucas so far, what we'll hear from Katie in a moment, are all information that can be used to inform what's going on the state level as well. And let the people who are working in the state level know that this is going on, because I know from being in Georgia, many don't. And so myself and others from Georgia, like Tracy, have to be a vehicle to bring this to them. Yes, and Denise is really just calling out that there is no one model for CHWs. And that's why there are some challenges with some of that language. 4 years from now, concerning, So Denise is concerned about one provision, which would be what we heard about the evaluation 4 years down the road once this is implemented, and what that could look like, what it could be shaped like and look like. And I know we have many people who are on this call who might be part of Common Indicators and other evaluation teams that are really responsive and reflective of our workforce. Shout out to Romana. I see something from the North Carolina CHW Association. Yeah, concerned about the term paraprofessionals. Romana, you bring me back to some major challenges we've had with multiple languages. Para means almost, y'all. We've worked hard since the early 90s to help people understand that we are a profession. We have a scope of practice. So I hear you, Romana, with that concern, and shout out to the North Carolina CHW Association. Yeah, the medicalization, clinicalization of the field. We have opportunities to shape this. If one thing that we get, we're still doing good on time. So I'll offer the floor to any of the co-presenters who want to chime in, who are also looking at the chat, because we are doing good on time for today, but we really are starting this conversation at a time where we have the potential, the possibility to make some major changes to how things move forward. So once again, we're sharing this during this policy brief. There'll be follow-up within the NACHW newsletter. There'll be follow-up on the next policy brief. And in between now and then, we must continue to have these dialogues with each other. Yeah. All right, now I see some references in the chat to an APHA policy from back in, I believe, 2014, which really focused on guidance that any group, any task force, any coalition, any state-based or local entity that is talking about CHW workforce development training, credentialing should be 50 plus, more than 50% CHW representation. And there's some of us who've gone further to say CHWs actually should be leading those efforts. Carol asked about the Bureau of Labor Statistics standard occupational code. I'm not sure what that's exactly about, Carol, but we, in 2009, we advocated and were successful in getting that SOC code on the federal level. And I know NACHW led some efforts to make some amendments to that definition that was just referenced earlier. And I think there's still some work going on there. But there you go. Denise just responded. Any comments from any of the co-presenters? We're still good for time. And Katie will get started next on CDC public health infrastructure funding, if we are good to move on. All right, so everybody, I put Katie's, it's way up in the chat now, but I put Katie's bio in the chat, but she's the Executive Director of Public Partners in Health USA. So I want you to say a little bit more about yourself if you have a moment, Katie, and the microphone is yours. And the next slide should, yeah, thank you.
Great. Thanks so much, Darrell and team, and really happy to be here along with Justin and Lucas. So Katie Ballback, Executive Director for PIHUS, which is the US arm of Partners in Health that we stood up initially as part of the COVID response, and now as a longer term program of PIH, including a heavy emphasis on our federal and state advocacy work that Justin and Lucas lead. So I'm happy to share a brief update as well on the CDC Public Health Infrastructure Grant Program, which I know many of you on the line and NACHW were involved in seeking to shape early on in the COVID response work. But go to the next slide. This is a large, $3+ billion investment that is primarily coming from ARPA funds, from the American Rescue Plan Act funds, that we know, early on, as many of us were working to try to influence that initial resourcing of the acute emergency COVID response needs in terms of workforce and other essential investments. We're pushing hard to make the case that this was an opportunity and an essential moment, not just to respond to the immediate acute needs for the emergency COVID response, but to really take this as an opportunity to invest in the essential public health workforce, community health workforce that we know we need for the long-term health and well-being of our communities. So, this, I think, same as I think a bit of what Justin and Denise and Lucas shared, some good news and some bad news with sort of how that funding ultimately was shaped through this program. But I know Denise and I and many other NACHW member organizations participated in some listening sessions with CDC last year, trying to shape how these funds would be programmed by CDC. And so that ultimately resulted in these funds being awarded and released at the end of last year to health departments across the country. I think the good news is that the bill and the funding were structured in a way that allowed significant flexibility for local jurisdictions to really tailor and focus their programming and design to their most critical needs, that it was a 5-year commitment. So rather than kind of 1 or 2 year grant cycles, allowing a little bit of a longer term view to think about investing in workforce and planning over a 5-year period. And the overall kind of focus for the funds, again, pretty broad. The first goal being to workforce, and the second broader kind of foundational capabilities. So the first, goal being really to recruit, retain, support, train the public health workforce, broadly speaking, including community health workers and health functions, but includes a broad other set of kind of public health workforce considered in that as well. And then the second component really being on strengthening foundational systems, processes, policies within public health departments. So ultimately, that has meant, and again, we highlight here a piece that NACHW and other NACHW member organizations were quoted in back at the end of last year, calling out some of the challenges and limitations of how this funding was ultimately structured, in that the funds are really set up to run and work through public health departments, both state and local public health departments. There is an encouragement to local health departments to engage community organizations and community partners as sub-awardees, subcontractors in the program, but there's no specific requirement or direction around that community partner and community organization engagement. So based on what we're seeing so far in terms of how these funds are flowing and how we're observing and working with partners who are programming some of these funds, seeing a fair bit of variety in terms of both relative focus and emphasis on the workforce versus other foundational capabilities, as well as some jurisdictions that are heavily focused on community health worker investments and programs, and others that have not prioritized that and how they're allocating these funds. So if we could go to the next slide. So there is a new website the CDC has put up that's a pretty decent initial set of information about how these funds have been allocated. They are going to all 50 states, so the health departments in all 50 states, as well as the 48 largest city and county health departments. There is some additional funding for 3 national organizations, the Association of State and Territorial Health Officials, the Network of Public Health Institutes, as well as the Public Health Accreditation Board, who will be providing technical advising, evaluation support across all of the grantees. But, would just say, again, I think we're seeing in some cases a really clear and strategic plan among health department partners for how these funds will be deployed and programmed. In other cases, folks are really starting a planning process now that the funds have been awarded, and kind of revisiting their initial application and kind of scrambling to really think about implementation arrangements. So while in some cases, these funds are pretty well structured and baked, I think in other cases there really is still an avenue and an opportunity to get a seat at the table, influence how those funds are deployed, and where those funds are moving outside of the health department context as well. So just wanted to share those brief updates on how these funds are moving. I think we hope this platform will be a space where there will be continued accountability for sort of communicating out where and how those funds are being deployed in terms of workforce and operational systems, as well as sort of other partners that are engaged, but still a lot to be determined as these funds actually start to move through to health departments in the weeks and months ahead.
Thank you, Katie. Angie?
Can y'all hear me? Oh, thanks. Okay. I'm Angie Kuzma. I'm a community health worker in Portland, Oregon, and I work for the National Association of Community Health Workers as the policy and advocacy manager. I put a link in the chat, and Justin has put a note about that. And so I want to direct your attention to that last link and find where in your state, who got the money, how much money did they get, and think about, do you have any contacts at those organizations? Is your network working with that organization or that health department or your state health department? And so what actions or investments should your state or local health department prioritize when they're spending this money on workforce activities. Love to hear from folks, either, in the chat. I think there's so many people on here, we might want to use the chat instead. Rumana says CHW funding it was cut in North Carolina and the funds were added for teachers. Really? Okay. Wow, interesting. It's health departments only. Said that CBOs are not part of this. Paid jobs for CHWs. That's a great start. Yeah. Paid training programs. Curious, are any of you working with your state or local health department on how to spend these funds as it relates to community health workers? Apprenticeship, earn as you learn training for CHWs. Equitable pay, yeah. Thriving wages, how about that? Yeah. No, but it would be nice. Yeah. Sometimes health departments receive more money than they can actually spend. Yeah, I mean, you never, like, what's the worst that could happen if you called up the health department and said, hey, I'm curious how this is going to be used for community health workers? You'll never know if you'd ever ask. Investing in CHW training and using the funding to help serve our most vulnerable populations. Absolutely. Living wages. Tried to work with our health department, but they said they're still figuring out how they will spend it. Stipends for volunteer CHWs. Felicia, it's definitely going to ask. Awesome. We love to see it. Lily, you're saying build an IT or EHR or electronic health record infrastructure for better collaboration between CBOs, health centers, health departments, and include CHWs in patient workflows, organizational workforce policies. Absolutely. Kimberly is asking, what can I take back for an action item to the CHW Workforce Development Council meeting at 2:00 p.m.? Is this a meeting, this is with your local public health department? Curious? Sounds sort of like it, but I'm not sure where the CHW Workforce Development Council sits. They're referring to Virginia's CHW Association and IPHI. Oh, wow. Okay. I mean, I'm going to look to my co-presenters for some suggestions, but my first thought would be to ensure there's a connection between the association and the local public health department or the state health department that's receiving these funds.
Yeah, I think we have the next slide. First of all, I just love that folks are leading and pulling for information. So I think it may be the next slide that has a short list of action items. I don't know if we're ready to move forward, but a 2:00 meeting, that sounds like we don't want to miss that opportunity to seed some of that. Whoever put that in, that's real deal. You know what? I need something right now because life is moving right now. So first of all, I just want to thank all the presenters and everybody who is, must be 2 p.m. Eastern Standard Time. I'm not going to waste your time here, and we'll make sure that the slides are out too in case you want to pull some of this stuff up. First of all, wherever you are in the country, it is important that you have a network, an alliance, a coalition, an association of CHWs, promotoras, CHRs, and our allies. I want to urge leaders, if you're a network or association leader, to extend your meetings to CHRs on tribal nations, to promotoras who may not be members, but they are critical voices and that we start finding what is common. It is really up to us to drive this conversation. And folks may not feel like they have the power. I heard Julie say they're still trying to figure it out. That's not what the APHA policy says. It says that these workforce development decisions, that those decision-making bodies who are focused on certification or workforce development policy include and have equitable, equal, or greater than equal voice on those bodies of the workforce themselves. So we're asking you to join with your members locally, and of course to join the folks here, the policy committee and NACHW, to amplify our authentic identity, our roles and our capacity of as leaders, our capacity to co-design and develop, our capacity to evaluate, to monitor, to govern this type of activity. Drag the chat and make sure you can save it. Make sure that you find that link so that you can look at the funding that is coming into your state. As Katie said, it's coming into the state health department and in some instances to your local. Where are those dollars that are focused on workforce? It's not all for CHWs. There are other workforce members, public health nurses and communicators and epidemiologists and others. And we want all of the workforce to be strengthened. But what is the portion? What's the plan for the state? Ask those questions, right? And you can reach out to the policy committee or to us to find out who you should be talking to. But the question is, how will they ensure that CHW leadership and decision-making in these initiatives is going to be established, okay? Take this time to strengthen your role, your knowledge, read some of these letters, open up the links, take some time if you can, but also the role of your org, support your leader, okay, to have time and attention to some of this and give your stories, download the information that you have so that leadership in your state can focus on policy change. We hope that you will join with NACHW. And someone said about 20 minutes ago, what's up with a national movement and activity? And that is exactly what we are calling you to do. We're holding a unity conference and we hope that you can attend. We have a save the date. August 3rd is the annual meeting if you're a member, and you can join us in person or online for that annual meeting on the 3rd. The 4th and the 5th are the 2-day unity conference. Not all of the sessions will be streamed, but many of the sessions, all of the plenaries, including a policy orientation and rally that we're doing for 90 minutes to prepare for a national CHW Awareness Week that you can participate in your home state. Okay, you can go to your governor's office. You can use the August recess to engage. And we're going to provide a toolkit with a variety of activities that you can take part in that are no cost. If you're shut in, if you don't have a car, if you just can get on social media, that's powerful. If you want to do Zoom calls, engage your legislators, you want to go down to the Capitol, we're going to offer those, but you have strategy. We have experts in this room right now. We're just asking for all of us to come together around that. And so let me just ask Catherine to come forward. One of our newest team members, we're so glad to have her, and then we'll close out the session. But this is the call. Let's get ready, right? Let's get together, okay? Let's get activated for this incredible opportunity that Katie has laid out before us. We see the challenges, we see the barriers, we know the problems, but this is an opportunity for our workforce. So we're excited to join with you and to support your conversations, to align with you in these conversations. So Catherine, you want to come forward? And next slide, please. Is Catherine Martinez with us? I know she had some connectivity. I saw her have to log off and come back on. Okay, well, quickly, let me voice this over. Finally, as we think about a call to action, as we think about the omnibus section 2222, as we think about this unprecedented once in a generation opportunity of investment through public health that Katie just laid out, what are the resources and tools that you need? How can this collective be helpful? And maybe you have a tool, maybe you have a toolkit. Please offer that tool as well to your colleagues. What would you like to see NACHW lift up that might be helpful to you? Is it a checklist? Is it a script? Is it just another call like this? We'll give that a minute. And Catherine, if you're on the call, please, we'd love for you to come forward and introduce yourself. Yeah, Kimberly says a lot of folks aren't aware of basic foundational civic education. I loved that Justin took the time to talk about how we got here, right? To talk about how bills, how this language moves through committees and where it ends up and how. So that's really important, and we can do more of that. Thank you for votesmart.org. I don't know the resource, but it says here's a resource for identifying your policymakers. Everybody should have that, right? That could be your monthly. Are you reaching out as an association, as a network with monthly updates on the great work you're doing? Are you sending CHW stories to your legislators? A training on how to engage policymakers in our state. Yeah, absolutely. In preparation and ramping up to the Unity Conference, we are going to have additional webinars. Already we've got leaders. I don't want to call them out in case they don't want to be mentioned, but there are Promotora and CHR leaders who are doing things every month. Darrell, I know you're kicking something off in Georgia. You might want to talk about that. But we're going to be learning and sharing that learning. Do you want to share just a moment about what you're doing, Darrell?
Yeah, it's really, there's a group of us. So for those of you who are in Georgia, hope you've been connected to either the Developing Georgia CSW Network or the longstanding Georgia CSW Advocacy Coalition. Last year, we had a small advocacy day where we had a couple of legislators talk to us and strategize, similar to some of the stuff that we're sharing today. This year, we decided to do an in-person CHW Advocacy Day, which will happen in March. Matter of fact, 4 weeks from now, on the Capitol, where we're going to do some basic CHW awareness as one of the strategic moves prior to moving forward with some legislative asks. So the first step is we're going to have some community health workers, our public health commissioner kind of speak. We're also going to have some clients speak in a group at a church right across the street from the Capitol. We're then going to walk over and do a press conference on the Capitol steps. And then we're going to give packets and have CHWs and community members fan out and go visit with legislators. We have a small window of time to reach legislators here in Georgia. As some of you know, some legislative sessions are very short. And so we're going to do that March 7th before the big national day that's going to be happening with NACHW and PHI and others going to the Capitol in DC that following day. So that's what we're doing down here in Georgia. And I know there's many others. I think I saw in the chat, there have been some legislative days that have happened already this year. There are some that are coming up. And I also want to urge people, my mom was a 30-year state legislator. Build relationships. It's not just calling when you have an advocacy day. It's not just going up and making an ask. It's building relationships, sending birthday cards, inviting them to your events and activities. And I think that's really what all of us should continue to do. I know there are many on this call, as I saw the faces who have done that over the years, but legislators are people too. They have district hours, our municipal, our state, and our federal policymakers work for us. And they're people too. They put their pants on. So don't get, they're people. They are just like us. So I urge you to build those relationships. I'll stop there, but thank you so much for that, Mike, Denise.
Thank you, Darrell, first of all, for your leadership over these many, many decades. A lot of us can look and see where you've had impact or seated. Oh, Ashley, yeah, please come forward.
Hi, everyone. Thanks, Terrell. Yeah, I was just going to add to that and really wanted to emphasize that website, Project Vote Smart. Use that. If you aren't familiar with it, you can just put your address in there and it will tell you every single elected official who represents you all the way from the federal level down to the local level, and share that with your CHW colleagues, with your neighbors, with your friends, and let them know. And one of the beautiful things in there is that for every elected official and for candidates as well, is there are bios in there. So you can learn a little bit about them and their background. So, Darrell's pointing out very aptly that these are just people too. So you can find out, where they went to college or what they're interested in. And that really helps you build rapport when you go to see them. And then you also can find out what committees they're on. So if they are on health committees or, appropriations committees or things that are otherwise important in your, locality, state, whatever, you can find that information out. And then they also have, if they have specific position statements, those are in there, and how they have voted on previous legislation. So that can be really, really critical to getting to know your elected officials. Just wanted to point that out.
Oh, thanks for breaking down that resource, Ashley. Ashley, I think we're going to stay with you. Let's move to the next slide. Peter, shout out to Peter Salale working in the background on our team. Co-chairs, do you want to close out? This has been just fantastic.
Sure. Well, just want to thank everyone for taking the time out of their busy days to be here. We really appreciate you engaging with us, and many, many, many thanks to our fantastic friends and colleagues from Partners in Health for joining us and spending their time today. We appreciate that. We are always interested in what you want to hear about on these quarterly policy briefings. We're doing our best to try to keep everybody abreast of upcoming information. If there are specific topics that you'd like to hear about for our next quarterly briefing, feel free to throw them in the chat and we will make sure to read those. And you can always, contact us otherwise and provide feedback. I did want to say just one other really quick thing. For those who are interested in contacting their local health departments about this public health infrastructure funding, one good point of contact is often the folks who have been program managers or who have run the CDC programs funded through chronic disease, known as 1815 and 1817. The reason for that is that they are those programs involved community health worker strategies. So take a look at who has funded those who has received those funds in your state. Those are great points of contact because they already know about CHWs and may have some experience working with CHWs. So I think that is it. Darrell, anything else that you would like to add before we close out?
I thank all of the NACHW members. I thank all of our allies, partners. I especially thank all of the community health workers who will continue to build their knowledge and wisdom and helping others along this journey in this path. In my 3 decades, I've seen ebbs and flows in the movement. We are in a flow, y'all, every day. And shout out to folks like Carl and others who there's policy happening every day, and we really need to be guiding and leading this, but we have to understand and know it. And so this forum, this space today is one of those brave spaces where we can ask questions, we can learn together and push that forward. One of the things that we toyed with in the chat amongst some of the organizers is we actually have time. People signed up to be here, I believe, until 30 past the hour. And so I don't know if others who were the presenters want to mention or say anything to drive home any points. But I also feel that we could, if people have some comments, reflections, maybe open the mics. I know that's, so I'm just offering that verbally live. So that's where I'm standing. Justin, Lucas, Katie, any things you want to reaffirm, drive home? Anyone in this room want to share something that really you think will be helpful and valuable to this large, august body from over 30, I think I'm up to 34 states in this country? Please raise your hand. And all right, Carl.
Real quick one, I did post in the chat, but We didn't really talk a whole lot about Medicaid, but there is obviously a lot happening in that space. And there are a lot of cautions and sort of, I guess, provisos that people should be considering if they're going after Medicaid funding in your state. So it wasn't the main focus today, but I did want to mention that NACHW is offering a 2-hour webinar to CHW leaders in your state. It should be open to any CHWs interested, obviously, but it's meant to help you feel more comfortable being in the policy space, talking about Medicaid payment with state officials and others in your state. Medicaid is complicated and it is confusing for all of us. There are a lot of fine points to it. So if you please reach out to NACHW if you would like to have one of these webinars for your state. There's no charge for the webinar if it is open only to CHWs, but we've done it in 8 or 10 states so far, and we're happy to do it for your state if you like. So please reach out.
Thanks so much for that, Carl. Just while we are in the house of CMS, Angie, I'm going to put into the chat the letter that you helped lead for the RFI. And this is another, we're just making sure if you're a member that you're aware of what the National Association of Community Health Workers is putting out there and how we're engaging. Angie, could you just voice over a couple of things? I'll put the letter here in the chat, and then Pam, thanks for your patience.
Sure. Yeah, so the Centers for Medicare and Medicaid Services sent out a request for information, and they were asking, hey, how can we include CHWs in Medicare? Basically, like they were just looking for information about that. And NACHW submitted a letter, and we had sort of 4 main points in that letter. We urged them to, adopt the full APHA CHW definition and the C3 scope of practice, to promote equitable payment and pay CHWs for their lived experience. 3, embrace CHW-driven evaluation, consult a national CHW Common Indicators project. And 4, eliminate barriers for community-based organizations that employ CHWs. So you can check out our letter there and the link that Denise provided.
That sounds like a 4-point program for life right there. Lord, if we could see some of those things come forward. What a transformation. It's just an acknowledgement of the excellence from the field, right? That we can draw on the common indicators, that we can draw on the C3, and that we really are elevating and centering CHWs promotores in community and in community-based organizations. We work everywhere. I've worked out of hospitals and local health departments and mobile healthcare vans and, primary care, but we have the community commitment. Pam, I'm so long-winded and you're so patient. Please, Pam, come off mute.
Thank you so much, Denise. So recently retired, 43 years of experience in early childhood public health, always with the community health worker model at the heart and soul. And I'm so happy to say we are not paraprofessionals. We are professionals and we deserve better because our communities deserve better. So thank you for your undying support. This is a shout out to New York, and we're pending CMS approval using the Medicaid 1115 waiver. I'm staying on top of it and really looking at what's going on in New York State generally, and then specifically developing that rural CHW network, either statewide or region. And I've connected with a couple participants today, so thank you for the chat option. Anybody can email me. It's Pamela, PAMELA.Guth, GUTH @gmail.com. For now, I'm volunteering my services to take it to the next level. Thank you all so much. I get goosebumps. You inspire me every time NACHW does any kind of webinar. And I know I owe a few of you some emails, but I'm not stopping. Retire is a oxymoron for me. It is who I am and what I do. So thank you.
You are so kind, Pamela. We've been connecting over the past couple of years. You know,
Yeah.
I just want to give a shout out to everyone here. First of all, your own leadership, your innovation, your advocacy, your history of doing this work, your history as a CHW or as an ally. This is the kind of thing that we need to amplify because it's needed in this time. And that I just love how Pamela was like, look, hook up with me. Here's my email. Let's get something done, you know? And I'm honored that NACHW can create a space where things like this can happen. I think this was the vision of the founding board members, many of them who are here. Shout out to Lily Lee, one of our board members who joined. It's just an amazing space to see. Let me turn it back to Darrell.
Yep, I see Ramona next and Carol after her. And just so you guys know, some of these gatherings become support group. Tap into this power, this energy, the spirit. We all need it because we have to go back and do some of those challenging battles on the ground on behalf of our workforce and our people. So thank you all so much. Ramona, the microphone is yours.
Thank you, Darrell. Thanks, Denise, PIH. You guys are doing, sorry, I have a cold. You guys are doing amazing advocacy work on policy nationally and locally. I want to lift up, NACHW has been advocating for APHA CHW policy that got passed in November. I put in the link further up. It's a press release that NACHW put out in partnership with APHA CHW section and CHASM. We have a meeting coming up February 23rd on Thursday. I'll be sending out the invite shortly. I apologize. We had to coordinate with some different people and different activities going on around the policy. It'll be at 2 p.m. So if you'd like to be added to that calendar, please, calendar invite, please email me at ramonassr@gmail.com. I'll give you updates at that meeting. And we're actually, NACHW and PIH are coordinating a visit, and we wanted to get your comments before that visit took place on the Hill. So that meeting will also be around that as well to get some collective comments from CHWs that have worked on this policy. Thank you, everyone. Great to see you.
All right, Ramona, representing North Carolina and the nation. Carol, you're up next on the microphone from California.
Yeah, hi. Thank you. These policy meetings are always very, very informative and great to see everybody. I think one of the things that I'm still personally really concerned about is immigration reform. I think it really impacts the ability for our undocumented, mostly in California, promotores de salud, but not only the other folks that are working in refugee and recent immigrant populations are really affected by that. And I think it affects all of us as a workforce. And then the other conversation that I'm wondering if this group will pick up on is the overlap in the behavioral health or mental health arena between the community health workers and the peer support specialists. In California, we have two separate benefits. So it's very confusing because some of us work in both. Some of us are trained. And certainly, I think as an employer, deciding which bucket of money you are going to be using to pay your community health workers or your peer support specialists, as the case may be. But in terms of professional development, I'm wondering if there has been a conversation between those two pathways. I see Carl maybe has a response to that. I'm not sure.
Yeah, real quickly. Yeah, if I'm hearing your question about the connection between peer support specialists and CHWs and the Office of Minority Health at the federal level has been convening, in fact, some of the people on this call with leaders of national peer support organizations to find common ground, how they can share strategies for success in financing and things like that. So there is some very interesting work being done on that. So I appreciate that. It's peer support specialists are a very important and very closely related profession. And there's a lot in common in terms of skill set and so forth, and the importance of lived experience in both cases. So thank you for bringing that up.
Yeah, Carol, and there'll be more on this because one of the reasons why that group that was also part of with Carl and others got brought together was because they're looking at our success in creating the standard occupational code, and they're potentially looking at pursuing it. So that was part of the conversation. And that's where we talked about our synergies and some of the differences in our workforce, but supporting one another, going about it in a supportive way. So thank you for that question, Carol. We'll bring that up. We'll have more on that to come. I want to pass the microphone over to Heather, and then I know I saw Betsy's hand up as well. But Heather, the microphone is yours.
Thank you. I'm kind of thinking back on what Carl had said about Medicaid. And here in Northern California, we're in Mendocino County. We're actually by County Sonoma and Mendocino County, my organization. And we have just begun a CalAIM program, which is through partnership, which is our contractual Medi-Cal up here. And our CHW, there are 4 CHWs in my office, and much of the work that we have been doing for the last 6 years is now going to be sustainable. So we'll be able to do some billing for Medi-Cal and help our most vulnerable populations. It's called the CalAIM program. And it's a pilot up here right now, and we're super excited about that. So really excited to begin that process. Just wanted to let you know that that is happening up here in Northern California.
Thank you so much, Heather. I think we might have lost Betsy, but I also want to throw the microphone back up and see if any of the presenters today or any of the NACHW staff want to help close us out. I think we're coming toward the end of this call. We can still give people back a few moments. I'll pause there and see if any of the presenters and or co-hosts.
I'm here. Can you hear me?
Oh, yes. Yes. Thank you, Betsy. Yes, we can hear you.
Well, first of all, thank you very much for doing such a great webinar. And lastly, to mention that I have been invited to El Paso to Proyecto Vida. They're going to be having an interesting meeting with many folks that are CHW related somehow, somewhere. And they're going to be having this meeting to talk precisely about financing and sustainability. They will be having 2 panels, and I think that they're doing such a great job by looking into El Paso, who has some sort of relationship with community health workers in any given way, and that people have been invited to talk about these things, many of the things that have been discussed today. So I have been invited to be in one of the panel, and as soon as I learn more from that meeting, I will report back to you all, just to let you know that that is happening in El Paso in this month.
Thank you, Betsy.
Thank you so much, Betsy. Oh,
Atlanta,
sorry,
Georgia. No,
sorry, Darrell. Can
I'm
you
just
hear
giving
me?
a shout out where she's coming from, Atlanta, Georgia. I got you, Denise. Go for it.
Okay. Yeah. First of all, Betsy, I want to thank you for your leadership as well, your solidarity, your lived experience. All of the speakers, I don't know all of you personally, but it's amazing to hear the work from across the country. Just a shout out, we'd love to amplify your work. You don't have to be a member. If you sign up for our free newsletter at info.nachwa.org, or you can just go to nachwa.org and scroll to the bottom. There's opportunities, we'd love to just say, here's great work that's happening in Northern California. Here's great work that's happening in Pennsylvania. So we'd love to hear from you. That's the first thing I want to share. The other is, there has been a lot of conversation. We haven't absolutely said sustainability so many times on this call, but one of the things that is exciting to many members of this community, and hopefully you as well, is as we talk about taking the moment to a movement, we're really talking about sustainability holistically. We don't actually have a definition for sustainability. And I think, a shout out to Carl, who, fortunately he can do some of these meetings by Zoom, but has sort of, gone from coast to coast, from north to south, engaging and supporting CHWs and authentic allies in leaning into conversations about financial sustainability that do not reduce us down to what are the codes we need for reimbursement. When we talk about sustainability, we are talking about, first of all, who CHWs are. You know, let's just go back. When we talk about section 2222 of the omnibus, one of the central deficits that Justin talked about, that others talked about, is that there's not even a definition of who community health workers are. Not even the APHA definition is there. This is why we have to, you know, bring together this type of coalition, this type of community to look circumspectly at the legislation, right? At the funding, at the NOFO. You know, many of our organizations, CBOs, are strapped for cash. So I understand that we get excited if any dollars come into our state. But to make the moment a movement, it's time for us to make the conversation and the statements about racial and health equity and social justice manifest. Okay, manifesting in the models, manifesting in the legislation, manifesting in the funding stream, manifesting in the work group, in the composition of the advisory, in the evaluation. And this is, I'm not telling y'all what you don't know. I'm just saying that NACHW, we're here for it. We don't have all the answers. We look to partners at the hyperlocal level, at the state level, at the national level. We want to hear your innovation, your solutions, your expertise. We're so excited to have you as members, as partners, as allies, as leaders all across the country. And I just want to make sure that you feel our love and support. You know, I mean, we got great OGs, Ashley and Darrell leading the policy committee. I mean, come on. You know, these folks have helped to seed conversations in all places. And so we have excellent leaders here. Many of our board, as I said, are here. I don't want to call y'all out or I'll be here all day. Leanna, I mean, folks are holding it down in their states and all over the country. So again, you know, we anticipate, I wish Catherine, our new staff member, couldn't join, but we anticipate supporting the work that Darrell is doing in Georgia. He talked about his advocacy day. There are other advocacy days. Big shout out to Dia de la Mujer, Venus Gines, Maria Coronali Ortiz, and all of you in Texas who might be joining her in Austin for an awareness day that they're doing in April. We want to support what you're doing at the local level, and we want to try to join together for a national awareness day. We want to hear your voices and we want to support you. So it is a collective movement. So, you know, these webinars, we're so grateful for your time because we know you're busy. A big shout out to Partners in Health, you know, for help. Listen, Partners in Health has created space for NACHW. We've been working together for the last 3 years. We've seen them show up for us, but more than that, for CHWs, right? Creating space and not rushing ahead of the workforce. They work authentically with the workforce in Immokalee and the Navajo Nation and other places, right? And they've partnered with us during the pandemic and beyond. So big shout out. We thank you because this helps us grow. This helps us do what we do. Okay, with that said, Darrell, Ashley, please close this out.
That's it. What more could I possibly say? Just thank you all again for being here. It's an honor and a pleasure to work with you all. Thanks for your time. Thanks everybody for bringing such fantastic questions, ideas, energy. And let's all, you know, continue to work together to support one another to advance this work that we need to promote equity and justice in our communities. Thank you all. I look forward to seeing you all again soon.